So interestingly, very little. And I think it's twofold. One is we're able to continue doing the operations because these are we have the tiering system that's here, and these are generally tier one operations. And so we've been able to continue doing the operations. I think the things that we've learned and the difference is we're doing more telemedicine visits, which in some respects are really good, and allow us to meet people, the burdens that they're going through. Many are getting chemotherapy or will be getting chemotherapy, allows them to stay at home and be in their environments, and then meet us, close to the operation. And so that's been very good. I think the hardest thing on most people, that's been the biggest detriment, is that many hospitals, and ours included, for a period of time, we're not allowing family members to be in the hospital with folks. So that is a hard thing, but what we have learned through that and adaptation is that we've been better than ever in communication. And so, just today, I was in the intensive care unit, and one of the intensive care unit docs said, I call the family directly today, let them know what's going on. Previously, that wasn't something, to be honest with you, that was happening, right? You may get a call from a nurse to update you, but now the ICU docs are being really thoughtful, and they understand what it is to have a loved one in a hospital for a long period of time, and the angst that goes on when mom and dad or grandma and grandpa are in the hospital, and you can't have that touch. And so we certainly feel like I tell people we're a family program, right? No one suffers cancer by themselves. It's a family disease. And so we want to feel like that we're part of your family and you are part of ours, and we wrap you up. And that's an institutional imperative. And I think some people would kind of be shocked that that's something that I'm saying, like Johns Hopkins, this, ivory tower, that you would have this kind of familial atmosphere, but it's true, right? And I tell everyone I'm not that smart of a guy, but I want to make sure people feel really comfortable where they are, and that's something that I'm supremely proud of, that we as an institution and we as a program are able to provide.
We obviously have a very diverse patient population. We take care of people from right here in Baltimore to all over the world, and I think that has created an environment that is very sensitive to people's needs, actually, and I think that allows people to feel comfortable. And I've heard that from a lot of patients. Said, I really just felt comfortable with the team and inpatient side, outpatient side. In terms of COVID, though, in the initial phase of things, obviously when elective procedures and screening studies and different things were slowing down, we did see some decline for almost a month or two, April and May, of people just getting new diagnoses. It wasn't that we weren't operating on people that needed an operation. It was simply just the referrals were not coming through. But I will tell you that the summer was the busiest I think we've ever had. And in the fall and now in the winter, we are absolutely slammed with cases and new referrals. I think there's been a delay in diagnosis for a lot of people during COVID times and getting that CAT scan or getting that colonoscopy. So to that end, I'd encourage everyone to stay on it and continue to get routine care. If you have rectal bleeding or what have you, see a doctor and get evaluated. But in terms of COVID now, we've been able to keep people safe. We've been able to keep them in a separate part of the hospital. We're not, treating COVID patients and then doing a Hipec next door. We have two major wings here, and the cancer part of our hospital is mostly separate. And so we've had actually great success with keeping our patients safe and getting them through the process. And there are some hiccups along the way in terms of testing and making sure that you get your test done on time before surgery, et cetera. But once we get people to the operating room and get them through their recovery, we've really had no issues. And so I anticipate fiscal year 2021 to be our busiest in the history of our program, despite the pandemic.